10 years on, Nigeria's health sector shows gains in infrastructure and disease control, but facing a worsening human resource crisis. The question is whether government can stop the brain drain while sustaining care for millions who depend on public hospitals. Over the last decade, investments after the COVID-19 pandemic improved laboratories, surveillance, and vaccine delivery. However, a deeper crisis persists, which is brain drain. Thousands of doctors and nurses have left for better pay and safer working conditions abroad. Some Nigerians call on the federal government to look deep into the health sector by making facilities available and improving the welfare of the practitioners.
Nigeria government to look into it, to look deep into the health sector. They should make facilities available, And I think, I would also want to advise the Nigerian leaders to make everything available.
Sometimes you get there, you will not even meet a doctor. Sometimes you meet one doctor serving more than 100 people. Before you know, you see most people down. You meet a nurse, the same thing.
I just say a word just now to clarify the whole thing. That is me, you understand? Health sector, a lot, you understand? So at least one thing can spoil the whole thing. You understand? Being it health sector, okay, fine, let's assume the Nigerian government decides to tackle the health sector. What about the other things?
The chairman of the Nigerian Medical Association, FCT chapter, Dr. Ayogu Emeka, assessed the health sector in the last 10 years.
We are not making very good progress. We are not making progress, especially public hospitals. Let me tell you, even where we have made some inroads, it's private hospitals that have really tried to bridge the gap. But because the poor service they offer is not accessible to the poor masses, there are still a lot of gaps. Private hospitals have done a lot of things. Those things that are used to encourage people to go outside to look for services.
He also suggested that 50% of the budget should be allocated to health sector to boost the health facilities in Nigeria.
That 50% of the budget should be allocated to health. As I speak with now, it's either 5% or less than 5% that will still allocate to the service of health delivery in the country. Those appear to have marred so many things. And as I said, they're telling you that it's an issue of funding, poor funding of health sector. And this poor funding have created so many problems, which includes poor remuneration to doctors, poor remuneration, poor health facilities.
The project delivery lead of the Africa Health Budget Network, Amina Khalid Muhammad, says there should be better health financing, adequate welfare for health workers to make the sector more vibrant.
The two areas that we need to focus on to boost the health sector would be health financing and accountability. So health financing would mean we would have adequate allocation for a lot of our health budgets. We would have those allocations being timely released and adequately utilized. Now, once we have those happening perfectly, then I do believe we would see a lot of our health impact, or rather the impact we want, all of the beautiful strategies and policies that we have, we would see it come to fruition. We would see us implementing them.
With adequate funding and improved welfare, it is generally believed that the health sector in Nigeria will meet the required global standard. Zahra Udas, reporting for Global TV News.